Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists nurse practitioners with employment contract and independent contractor agreement issues. Today I'm going to talk about RVU compensation for nurse practitioners. So, what is an RVU? How does it usually work? What is the usual compensation structure? And just so you have a general idea of what it is. So first, what is an RVU? It stands for relative value unit. The work RVU, WRVU is kind of how it's usually written out, is the most important part for any NP in a contract. And then what an RVU measures is the Center for Medicare Services comes out with a list every year. And basically every encounter / CPT code has an RVU value associated with it. The longer you're with the patient, the more acute the visit is, usually generates a higher amount of RVUs. And if you're just being paid purely on RVUs, you would just multiply the RVUs generated times what's called a compensation factor. So a monetary amount that varies based on specialty, geography, that type of thing. For an NP, usually somewhere between $30 to $50 per RVU. And then if you generated 1,000 RVUs in a quarter, multiply that times 40, and then that's what you would get. That'd be a little high if you do a quick math on that, but that's kind of how it works. Now there's different ways of doing it, and you can do, I guess there's hybrid structures as well. First, it's pretty rare to have any kind of outpatient, non-hospital, non-health network related position. So if you just join like a physician-owned practice, or if you're in a state where you can practice autonomously, if you joined another NP-owned practice, most of the time they're not going to use RVUs in their compensation. Where you will see RVU compensation will be if you're joining with a hospital or a healthcare network, and that's where they generally utilize RVUs much more likely. Now, I find the vast majority of NPs are paid a straight base salary. Maybe if you're doing urgent care, hospitalist work, ED work, you'd be paid like an hourly rate. But you're just not going to see it in private practice. So let's talk about how these are generally kind of structured. So first, you're always going to have, or at least you should, have some kind of income guarantee periods. Anytime you join an organization, it simply takes time to either build up your practice or get used to how the workflow is. So you'd want a minimum of a 1-year guarantee, and then ideally 2. And then how some health networks would do it, they would take, let's just say it's a 1-year guarantee. They take your production from the last quarter, annualize that out, and then they would give you a base draw every pay period. They'll usually back it down about 80%. So I'll just say and I'll use an example. Let's say you have a $120,000 guarantee in year 1, and then you hit $120,000 exactly as far as your RVU production. Then they take, per month you're generating or you're earning $10,000 a month. So maybe they back that down to $8,500, and then they would pay you $8,500 per month. And then they would do a reconciliation, usually at the end of the month, sometimes quarterly, where they would then take the RVUs you generated times the compensation factor. If you exceeded whatever they paid out to you, and that's kind of the point of this, they don't want someone to have some kind of negative accrual, then they would pay out whatever is left over as I guess you can consider it a bonus, although you earned it. And then that's kind of how it would work. And then each year they would look back and see what your production was, and maybe they change the base draw amount, but ultimately you're paid on whatever you produce. Other ways of doing it would be just to give you a straight guaranteed base salary and then have some kind of threshold. So for an NP, maybe in primary care, I'll just use 4,000 as the example, per year. And so if you have 1,000 RVU expectation per quarter, any RVU that you would generate over 1,000, they would give you, probably won't be between $30 to $40, it'd be less than that. But they would just multiply the RVUs you generated over 1,000 times the compensation factor, and that would be kind of what the bonus you would get. There's many ways of structuring an RVU related compensation. It's not a negative thing. Some people look at RVUs as maybe being unfair. I mean, the entire point of this was to incentivize some of the staff to work harder, see more patients, that type of thing. And so, I mean, this has been around, I'd say it really started getting popular around 25 years ago. And then organizations have kind of toyed with what's the best way of structuring it. But that's a little bit about relative value units for an NP. If you have any questions about your employment contract or independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care.